one of the witnesses, I think it was Mr. Blase, mentioned the Paragon report, which I think it has been established relies on double counting, partial year enrollments, healthy young people who happen to go a full year without going to the doctor or falsely conclude that real people are engaging in fraud. I have a number of analyses of these reports, and without objection would like to submit them for the record. There are 3 articles that describe these and other reasons why the Paragon report conclusions are wrong, as well as a recent federal district court opinion that described the Paragon research as, quote, data of questionable validity. They are a KFF article, Kaiser Family Foundation article, an AHA response, Keep Americans covered response, and City of Columbus court decision.
Objection. You'll, of course, have a chance to respond to that.
I'm sorry, were they entered into the record?
Without objection, I just
Thank
said
you.
Mr. Blase have a chance to respond to that.
Well, I don't mind him responding.
No, I mean, I'm in terms of bringing things to the record.
Okay.
So I think we did multiple reports this year and last year looking at improper and phantom enrollment, zero claim enrollment in the exchanges. One report last summer called The Great Obamacare Enrollment Fraud, and then a follow-up. It was very simple analysis. We just compared the number of enrollees who signed up claiming an income in a category that qualified them for a fully subsidized plan with the number of people from the Census Bureau that have income in that category that don't have other sources of coverage like Medicaid or Medicare. And it is a stunning number of people enrolled in that category who don't have that income level. And that's the report that we found in 15 states. There's more than twice as many ineligible enrollees. And the criticisms of that report are really they're laughable. They say that we can't bring data from one year to the next, but that is done routinely because Census Bureau data wasn't available for the same year, so we just needed to make slight adjustments to go from 2024 to 2025. The second set of reports you're referring to is our analysis of zero claim enrollees. In August, so if you have a lot of improper enrollees, we then expect, well, many of these might not be using any medical claims, and CMS in August released data of the number of enrollees who signed up at any point in time during the year that used no medical services. And in 2021, it was less than 4 million people enrolled in the Obamacare exchanges that used no medical services. In 2024, that had increased to almost 12 million people. So that's publicly available data. Your staff, they could run those numbers. And one of the issues was we couldn't identify, and this is from the data, whether people were enrolled for the full year or for the partial year. We presented that finding. That's the same limitation that was in prior years. But if you look at the total market, it was 35% of all enrollees that used zero medical claims in 2024. It was 40% in this fully subsidized category. And in the normal insurance market, you would expect that to be about 15% of enrollees that didn't use any medical claim. But all of the data is publicly available, and we clearly stand by the research.
Thanks for that explanation.